Friends, in today's session, we will discuss about some important things and a general approach to city. Will be very useful for those who are beginner in city, and we will be covering some important points and in a sequence. And what are the basics about the CT scanner, what are the its parts, gantry, the patient couch, what are the things, and its functionalities also, obviously. Number two, we are going to cover various planes, like either axial plane, sagittal plane, or a coronal plane. We are going to discuss about this and their significance also. Number three, various windows. You might have seen there are various windows. Some mediastinal windows are there. They look like slightly different from HRCT or lung window and bone window, and what are their significance and significance of cross-sectional study. Because if you don't cross-sectional study in CT, if you don't know cross-sectional study or cross-sectional anatomy, and then how will you differentiate between a normal organ or normal part with a pathology? So it's very important part, and one should if one want to learn CT scan, then he must be at least get mastery over the cross-sectional anatomy or cross-sectional study. And next thing, I will going to teach you site determination, which is very important, and short introduction about our city learning program, our upcoming city learning program. And for most of you, I've joined and applied for. So I will be telling about that also. And some after that, some mediastinal pathologies, important mediastinal pathology. You will gain something new. Okay, and some patterns in the lung window or HRCT. There are some patterns according to which we can make differentials or diagnosis in HRCTs. And most important nowadays, COVID radiology. Okay, so when pandemic hits, then lot of radiologist report may take several days to come. So you are the clinician, you should be able to analyze the just X-ray films, because you cannot just ask the technician or visit the view console and check the scans, and you can analyze what are the how much lung is involved and the severity scoring is, and accordingly you can decide whether the patient need a hospitalization or he can be treated as a home isolation. So like this, you can save many lives. So it is important when pandemic hit. Right now, there is no COVID cases seen, but still COVID is not eradicated. So we should have knowledge for this, and we should remain prepared for this in advance. So we are going to cover all these important things. So watch till the end. Okay. So so first question arises in every people mind, that why clinician must have knowledge of CT scan? If there is an expert person like radiologist is there, then why should we go for a CT scan or like this? So this is CT scan, which is previously were considered as an additional clinical skill. Now it become a necessity to practice this medicine. And if you are suppose some pandemic hit, it's very important for you to learn CT. Moreover, you can increase your clinical skills. Some things like we teach, like X-rays, ECGs, and this CT scan, these are very important. And who are the bright doctors, they have good skill in everything apart from their specialty. They know a lot of things about. So it is just to increase your skills and all that, and use and hopefully in emergency condition when there is no radiologist, you should be able to analyze immediately what kind of emergency is there. Suppose there is a head injury or some kind of chest injury, you will be able to assess the severity of the case and accordingly prepare the patient to shift, whether to shift to the OT, and inform the concerned specialty like neurosurgeon or like that. So it's very important, because suppose you are in the midnight, you're at 12 p.m., radiologist is not available, CT scanner is there, technician is there, you can just immediately get scans, and you can discuss or telephonically with the concerned specialty that these are the things, and I think there is mass effect, suppose there is a head injury. So uh, you can tell neurosurgeon with the confidence that if this patient is not, we have to do his surgery, otherwise he can end up in a cardiovascular arrest due to tonsillar herniation in his cranial pressure. So like this, so it increase your skill. It is life saving also. Okay. Another thing, well, a lot of people might be thinking why to join this program and not other program. Actually, I'm telling you that other programs are also they are good. They are good programs. If you go for some other kind of program like some kind of theoretic program and anatomy physiology, and that's good. But when things comes to practical na, like x-rays or radiology or ECG, where you have to practice on, because every scan will look different, patterns will look different. So it's not like that you just learn from the book and going there and just making diagnosis immediately. So it's not like that. So you must be able to appreciate and know. So next, so here a little bit I would like to highlight platforms of the program. So there will be a one WhatsApp group, main WhatsApp group. You have to pin it at the top, where you will get daily notification. Program is of duration 30 to 40 days. Every day there will be lecture except the Sunday. So daily you will get notification, and you know WhatsApp is a thing. Every busy doctor cannot escape the WhatsApp messages, because um, it could be from the department or concern department, hospital. So during the program you can pin our group, and uh, you will get notification that what was the topic today is going to cover, we are going to cover, and what are the on what platform support we are going to cover on the Zoom. Then we will give you Zoom link and timing in that and topic you have to present. If you miss, then later on you can catch up. This is not a very difficult thing, because a lot of clinicians join our program. Though medical students don't join our program, they don't need these things at this level. But a clinician who have to face in day to day, they join, and it's very easy to catch up later on if you're not able to. And practice session, what's a practice session, separate group, in which you will be able to we are at a particular time we will making announcement, and in that particular time we are going to post some clips, not CT films, clip, so that you can scroll up and down, and you can analyze yourself. Okay, so it is very important. So more you practice, more you will learn. So let us now discuss about CT scan or computed axial tomography. So do you know why it's called axial tomography? Why not? Although there are other sections also, sagittal, coronal, and why only axial? Actually, a CT scanner rotate around the body and take an axial section first. Later, it send the information to the CPU or central processing unit, which create different planes like sagittal, coronal later on. So here you can see its part. This is a patient lying on the patient couch, and there is an X-ray meter on one side, and just opposite to is a receiver. This X-ray meter will this X-ray emitter will emit the X-rays, and it will pass through the body, and this receiver will catch this, and this scanner will rotate very fast at very fast speed, and this around the body, and whatever the data gathered will be sent to the central processing unit or computerized unit. Then it will create the image. So how this is this CT scanner works, you should know a little bit about these things. So next thing important are the windows. All of you might have heard about the window, you might have seen the scan. Some scan look like this, others look like this. So if you look at this scan, this is the soft tissue window, or we also call it mediastinal window, because here we mostly concern with the mediastinal structures like heart, vessels, other things. So this is here you cannot see the lung pathology because lung appear totally dark. Windows is nothing but a technical setting of a CT scanner. Just you set the technical setting to the mediastinal window, you will find this. And if you set the technical setting to the lung window, you will find this. Similarly, bone window. Okay. So it is very important in analyzing the mediastinal pathology, especially if there is some pulmonary thromboembolism, embolism there. We can do contrast and non-contrast study, aortic aneurysm, aortic dissection, lot of things, pulmonary thromboembolism, mass. So it's very important. okay, and lung window. Here, although you cannot appreciate mediastinal structure well, but you can see lung parenchyma, and in lung parenchyma you can uh, you can analyze the various patterns and pathologies, any abnormal changes and like that, and then you can make the differentials and DD. And bone window, although X-ray is more important, just if there is a injury you can visualize the X-ray because it is anterior posterior. But here the in axial section, because the ribs are placed obliquely, so we cannot visualize the complete rib. Okay, they will be seen as a obliquely. So in the like this, not complete. Okay, so it don't have much significance, but still in some cases there are significance. The next, let us discuss about various planes. So there are three types of planes: axial, coronal, and sagittal. So axially like this, I'm sitting, just cut my body like this, you will get axial plane. Like you can see that this very common. Okay, or if you cut the body like anterior and posterior part, anterior and posterior part, my body anterior posterior, what will you see? Just imagine that will be a coronal section, coronal. And if you cut my body like this, right and left half, then you will forward image you will get, that is a sagittal plane. So very simple, nothing much complicated. And you should have knowledge about these things, because in CT there are some pathology which can be more appreciated in this sagittal or coronal plane in comparison to axial. Although axial is the most commonly used window, but when sometime what happen when we, just let me play this video. Here you can see these are the various plane at the same level. As this video will move, you can see, look at here, and you can see, suppose you some pathology at here. So at the same level in the coronal and sagittal section, you can just check what is this. Okay, sometimes from one angle something is not visible, so from another angle it is visible. So that is important. So in a CT scanner you can visualize all these section. You go through first axial section. If you see some there could be some pathology over here, just check in the sagittal as well as the coronal section. The things will get clear. Something will get more clear in the coronal section, like aortic coarctation of aorta, even aortic dissection also. So this is the important thing. So next is site determination. So site determination is also important. So although it's very important, nothing much rocket science about this. So here you can see, just imagine that patient is lying in front of you, facing his feet toward you. Okay, just imagine patient is lying in a CT scanner, facing his feet towards you. So your right will be his left, and your left will be his right. So here you can see from this very clearly, his patient left will be right. So here on the CT we can make out this is left side and this is the right side. Now, what is the significance of cross-section study? So friends, it is not being taught in any program. Even the radiologists are there. Their professor don't teach cross-section anatomy. They ask you to go and look for some book and read yourself. So, but in our program, we know that if we start doing like this, then there could be possibility that student will not read, and until unless they do not understand the cross-section anatomy, further it is impossible to understand the CT scans. So we are going to give you comparative study in a cadaveric section as well as CT section. Why cadaveric section? Because during your this first year anatomy, you might have some idea about the cadaver and what are the various structure. So that's why we are going to give you a comparatively study so that you can remember all those things. So let me first show you this cadaveric section. Let me enlarge for you. So first I will be going to teach you the cross-section anatomy, then I will give you practice session of the slides, cut slide. So here you can see this is the cadaveric section. Okay, so this is the video. We are going from the top to bottom. In a CT, we always move from the top to bottom. So as you can see here, it just we are starting at the root of the neck. Just wait a minute. Let me pause this video. So this we can see these are the apex of the lungs, and here we can see some structure. So this is the left brachiocephalic vein and the right brachiocephalic vein. I will tell you why it's looking a little bit oval and this is vertical, because left brachiocephalic vein is slightly obliquely placed. And as we proceed, yes, so here you can see vertebral body. So you can estimate, you can analyze that which part is the posterior and anterior. Anteriorly you will find the sternum. Okay, so not a very big deal. So this is how you see left brachiocephalic vein merge into just merge into superior vena cava, to right brachiocephalic vein to form the superior vena cava, and other structure are also emerging. And as we move further, so we are at the level of heart, and just above this we can see this is the pulmonary trunk, and like this is the superior vena cava opening into right atrium, and like this. So in just I am giving you superficial idea. I know in just one attempt you will, because it take 1 week at least to study each and every part and also practice over that. So as you move, and you can see here, we can see here posterior part. This is the right atrium, and just below this is esophagus. That's why you might have heard that enlargement of right headed falls indentation of esophagus. So how now here we can see just right atrium is appear, and right atrium, this superior vena cava is just merging into the right atrium, and on the anterior part there is a right ventricle, just part of right ventricle. So this is the you can see, I just told you, left atrium is descending out, ascending aorta, this is descending aorta. So here little bit you not appreciated, here you will find an esophagus. So let us proceed further. So now here you can see thick muscular mass. So this is suggestive of left ventricle. Left ventricle has thick muscular mass. So this is the left ventricle. Okay. So here this is the right ventricle, because right ventricle forms most of the anterior part of the chest. So this is right ventricle, and this is the right atrium. And in cadaveric section, it's not very easily can be appreciated things. So here you can see this is the left atrium appeared completely, and this is the right ventricle, and you can see here this structure. If you don't know what is this, you will start calling it tumor. This is actually a dome of diaphragm. It will just emerging on the right side. Right side it is at the higher level. So we can see earlier at the right side. You can see here it's emerging, and now we have reached the base. So this is the diaphragm, and you can see here, so esophagus will open into the stomach, and so lot of things are there. So let us go superficially about. So friends, here I want to give you a comparative study with CT scans. This is how we teach. So this here you can see, this is the medicinal window, these are HRCT. We will be dealing with this part only. Okay. Same problem is getting. Let me enlarge it for you so that you will be able to appreciate the structure. So we will be dealing with this part, this mediastinal window. So let me play the video. Remember, please have a look at this very fast. So here we can see dark structure, hypodense structure. These are the lungs, apex of lung. And if you see carefully, this is the left brachiocephalic vein here. Right now you will not be able to appreciate well, but just for I'm telling, left brachiocephalic vein and right brachiocephalic vein. The left brachiocephalic vein is a little bit oblique. That's why in cross-section anatomy it's looking oval, and the right brachiocephalic vein is little bit vertical, so it will appear a little bit rounded. So what will happen, this left brachiocephalic vein will get merged with the uh, right brachiocephalic vein to form superior vena cava. And below we can see, if you just zoom at your mobile now, you will see three structures. These are the branches of aorta emerging from the arc of the aorta. As we go down, we are moving from top to the bottom. We have started from the root of the neck and we are going downward. So remember this point. So as we move down, we will see arc of the aorta. Now you can see here. So those three vessels I have told you, to be emerging from this arc of aorta, and this is superior vena cava here. Again, in mediastinal window, you will not be able to appreciate these structure, mediastinal structures. As you can see here, you can appreciate lung. So that's why we called it a lung window or HRCT. And now you can look here. This is descending aorta, this part, ascending aorta, and this is the pulmonary trunk. It is arising at this level. So you should have a mastery over cross-section anatomy, at what level which structure is going to be appear. Otherwise, you won't be able to make diagnosis. So it will get it divided into left and the right pulmonary artery, and very important part in diagnosing the pulmonary thromboembolism. Okay, so here will get defect when injector die. Now you can see, now we have already reached to the base of the heart. So you can see left ventricle, right ventricle, anterior part, and so on. So now let me tell you, after teaching all this, after giving lectures, study material, what we do, we conduct practice sessions inside our WhatsApp group, because everybody don't have a photographic memory. 1 in lakh person have photographic memory. Just एक बार देखा सब कुछ याद हो गया, but we are normal people, so we have to practice on it our own. So what we'll do, I will teach you from the videos, and then in the practice session I will cut the slices and will give you at various different design, and will ask you what are the various parts. So how this, I will going to just like this, I will post and ask that what is this, along with cadaveric section. Okay, I will teach cadaveric section, I will tell you, here you can see, I will ask you what are these structures. So these are the major branches arising from the arc of aorta, and this is the left brachiocephalic vein, the right brachiocephalic vein, and seventh, number 1 dark hypodense structure is the trachea. Number 9 is a vertebral body. We will also going to teach you at this, we cut the body at this level, that what structure you will find in detail. We are going to, I mean to say, in the detail we are going to give you this study. So we're going to ask you, so like this is arc of aorta, this is the trachea, this is fifth number is esophagus, number 2 is superior vena cava, number 6 is vertebral body. So now let me show you one thing, important thing is there. how we conduct these practice sessions inside our WhatsApp group. It's very important. Don't take it lightly. We will be posting some slide and we'll ask you name the labeled structure like this. You can check. I posted one slide and members are giving their answers. Somebody is writing and somebody is just typing. So I'm giving correct. After that, I will be giving a voice demonstration. If you have done some mistake or something like that, I'll be posting categoric section, will be asking you what are the label structure, a member will be answer like this. Okay, so I will be correcting their mistake. I will be posting the CT scans at various level and will ask what are the label structure. So this is how it is, like a classroom atmosphere. You will feel like this. I have posted this is ascending aorta, descending aorta, and this is the in between, this is trachea, this is zygous vein training into superior vena cava. So things will all these things are not difficult. Thing is that we never tried CT scan, so uh, sincerely that's why it looked like some kind of black and white. So it's very easy, it's not difficult. When you learn from us, you will become master. And thousands of people have joined our program and become thousands of them given positive video feedbacks, and hundred of the real video feedbacks available on, you can check my YouTube channel or website. So because they learn, because we believe in the teaching, real learning. And like here you can see lot of members are giving their answers. In the last we are going to post the correct answer, what is the correct answer. So like this. So in 1 week duration, first we will going to give you cross-sectional study, and in axial plane and sagittal and coronal also little bit, not too much detail, but axial plane is most important cross-sectional study. And after reading this, you will be able to differentiate. We will make out any kind of pathology. So next is let us discuss about some pathology part also, since you have joined and come here. So I wanted you all must learn something from here. So here friend, you can see that this is the mediastinal window, and you can see lungs appearing dark. So this is for mediastinal structure. But the fluid appear grayish inside the mediastinal window, as you can see here na. So it is forming crescent shaped shadow at the base, because when patient is lying in a CT scanner, so gravity dependent part becomes posterior part of the chest become gravity dependent. So fluid will accumulate, small fluid will accumulate at the posterior part, and it will make a grayish crescent shaped shadow. Okay, if there is a massive pleural effusion, then it can appear up to this level or this level. This is the minimal pleural effusion, and we can see in the CT scan easily. So now this is HRCT, as you can see, high resolution CT scan, and this is a case of pneumothorax. And all of you know pneumothorax means collection of air in between viscera, lung viscera. And here you can see this is the lungs, and this is lung, and you have seen this is the air, hypodense in dark. So this collection of air is collapsing, compressing the lung, and you can see very well, appreciate that this is the pneumothorax. So very easy. Uh, Sometimes something are very easily appreciated in the CT than X-ray. And next thing is pericardial effusion. Collection of fluid inside the pericardial cavity, the visceral and parietal pleura. So right now it could be difficult for you. You can see here sternum, posterior vertebral body. So this is anterior posterior part, this is posterior part. Here hypodense structure, this is the atria, and the receiving is the pulmonary veins, and here is the heart. Okay, so if you see, there is a thick layer of, normally if you know normal anatomy, thoracic anatomy, it will not appear like this. So fluid will always appear grayish. Okay, or we can say slightly hypodense than the lungs. So this grayish part, you can see thick grayish part. So this is the collection of fluid between the visceral and the parietal pericardium. Okay, so this is the new case of pericardial effusion. So this is how you will learn. So let us play a city clip. Here, both two windows are there. Mediastinal window will be there, and this HRCT will be there. And you have to analyze first. Okay, I will see if anybody want to comment, then he and she can write down the comment. It's moving very fast. This is the HRCT. Now let me explain. So now, as we see here, look very carefully. As you have learned in X-ray, that air fluid level. So here we can see this collection of fluid has a straight level. That means there is air above it. So this is hydropneumothorax. Okay. In pleural effusion, you will see on right side there is a pleural effusion. And as I have taught you previously, like pleural effusion, there will be a crescent shaped shadow, but not in this. Okay. Now look here. So both sides there is fluid. So this is pleural effusion. This is air above the pleural this fluid. So giving it the air fluid level or straight air fluid level. So we can appreciate that this is the hydropneumothorax, left hydropneumothorax, and right sided pleural effusion like this. Now in other window HRCT, the slight difference is in HRCT fluid will look hyperdense or bright. So here we can see this is also fluid, straight fluid level, but it is looking not grayish, it is looking white or hyperdense. We use specifically the term hyperdense. And you can see clear cut here. If you compare with the right side, this is the lung. Here there is no lung. That means there is air and collection of fluid. Now let us check where is the pleural effusion over here. Now you will not be able to well appreciate, but this is the thing. This is, although it is merging with the background, but when you become expert, you will be easily with. This is the crescent shape pleural effusion. Same case you can see here. Okay, so let us proceed towards some patterns which are most commonly seen in the HRCT or high resolution CT scans. Important thing is that in HRCT we have to recognize these kind of pattern. These are specifically for some kind of pathology, like tree bird. You could see na, these are tree bird. You will see in CT these opacities are like tree bird. So in HRCT, various pattern can be seen, like crazy paving pattern, which look like crazy paving, and some this tree and bud appearance, this ground glass opacity or mosaic pattern. So there could be differentials like tree, but most commonly in tuberculosis it is seen. Other condition also seen like bronchiectasis. You can see bacterial infection and other aspiration pneumonia. So there is a differential about it. Okay, let us discuss about little bit about CORADs. So CORADs is the report COVID-19 reporting data and data system. Okay, so we give that, like you if you have gone through, if you know the mammography, sonomammography, we give a Birat's classification, like this radiology CORADs classification. It tells us about the how much is the possibility of COVID pneumonia. So it was a proposed classification system for radiologists in the Netherlands, and still it in work in progress. Day by day, some updates are coming, and we will keep updating those all updates. I will remain in touch with all those updates. And here you can see uh, cohorts is there. So there are four types of stages. So cohorts one means either there is no lung, no infection, or there could be something but non-infective. Cohort one. Cohort two means there is infective pathology but not the viral origin. There could be fungal infection or viral. So we are going to cover this cohort 1, cohort 2, cohort 3. We will find some GGO. So radiologist will be little bit confused, or he will not be able to show whether this patient is going to be develop pneumonia or not. Cohort 4 and 5 are highly specific of COVID pneumonia. So this is about cohort. So during the program, we will go in much detail. We have collection of hundreds of video feedback. During the pandemic, we are the first person who started the COVID radiology and taught a lot of students. So a lot of things are there. GGOs, multiple lobe will be involved. I will teach you what are the GGOs. Very famous nowadays. Even non-medical know what are the GGOs. So if you post at some during pandemic, I have seen anybody posting some x-ray or people are saying GGO, it's not like that. GGO बहुत पहले के time से है. So these are some findings. Right now I not be able to explain you all the findings, but these are the important. GGOs are finding 100% cases. Multiple lobes will be involved and bilateral in distribution, and there will be more predominantly subpleural distribution and basal posterior distribution. Central may be spared, area may be spared, but not exactly. There could be septal thickening, crazy paving, septal thickening mixed with crazy paving, or like that. Bronchodilation and septal thickening could be also there. So there is a different and deep subject you have to learn. So let us tell you about. I have tried to make it simply what a ground glass opacity. What happened? So you might have seen this kind of glass. So this is abraded glass appearance. So you can see little bit beyond below this glass, but not clearly. So थोड़ा सा diffuse है. तो ground we in CT we call it as a ground glass opacity. Like you can see here. Just look at here. There is a grayish pattern. Okay, there is a grayish pattern, but you can see the vessels and bronchioles below that. Okay, in comparison consolidation, here you cannot see. Here you cannot see. Look here. You can see here na. So look here. So consolidation basically means solidification, total solidification. No, and here we can see only patent bronchioles. Some patent bronchioles could be there. These are the bronchioles. Not confuse it with some kind of other thing. So these are the patent bronchioles, and these are suggestive of the air bronchogram sign in consolidation. So in COVID pneumonia, we find the patchy consolidation, not lobar consolidation. So let us understand it of the pathophysiology of this. What happens when a viral infection occurs or there is inflammation? There is a collection of fluid inside the alveoli, as you can see here. So here you can see slightly collection of fluid, and you can see vessels and bronchioles beyond that. So this will look like this grayish. But as disease progress in COVID pneumonia, other pneumonia or other pathology, so it will become solidified. So like consolidation, it will become bright. It will look grayish. It will become bright. So it will become consolidated. You cannot see cross this. This will become opaque totally. This is transparent. This is opaque. So here this is the primary, secondary pulmonary lobule. At the peripheral region, you can see perilymphatic areas, and in the center you will always find a terminal bronchioles with alveoli and a pulmonary artery always adjacent to it. And let us move further. So we are also going to teach you a little bit about the pathophysiology and what are the pathology. Let me. This is the air bronchogram sign. This is present in the lobar pneumonia, where complete lobe is involved. Okay, it's not seen in the COVID pneumonia or other kind of pneumonia. This is where the complete lobe is involved. Here you can see there is solidification. Consolidation means solidification. The lung is totally solidified, but still there are, you can see these structures. These are the bronchioles. They contain air, so that's why they are looking dense, hypodense. Okay, dark. So we call it as a air bronchogram sign, and this is highly specific of lobar pneumonia. Okay, so this is not the sign of COVID pneumonia. Now, crazy paving pattern. So before understanding, we will crazy paving pattern is just a combination of ground glass opacity plus interlobular septal thickening. अगर इन दोनों फाइंडिंग्स को मिक्स कर दिया जाए, we will find crazy paving pattern. So you have might have seen this paving type of pattern on the floors, and this here you can see, you can this crazy paving is appearing here also. You can see na here also. So I have just Photoshop just for understanding purpose, Photoshop and video, just to make you understand what is crazy paving pattern. So let me play. So as I told you that crazy paving is nothing but there is the, look here on one side, this is two different, entirely different cases. This is the lung which is as a interlobular thickening, and this is the ground glass opacity. So when these both findings get superimposed, when one lung contain when there is a pathology which contain the interlobular thickening as well as a ground glass opacity, then it will look like a crazy paving. Now I have used Photoshop to mix these two findings to show you how this look. So let me play this video, very interesting video. What I have done here, there is a clone feature in Photoshop. I have just cloned this interlobar septal thickening area and just paste it over the GGOs. So now let us look how it appears. Look, I have cloning from here to here, and it will look like crazy paving. Not very much appreciated over here, but definitely I'm not very good Photoshopper, so you will look like this. But I have given you idea that combination of interlobular thickening plus ground glass opacity is crazy paving. Crazy paving. It's also seen in COVID pneumonia and other condition also. Okay, so now what happened? As I told you that about the ground glass opacity. So these are the ground glass opacity. We can see across them, but we can see some vessels clearly grayish. Okay, so what happened as disease progresses, whether it is any kind of pneumonia, these are particularly seen in pneumonia, COVID pneumonia, other pneumonia. So as disease progress, what happened? This become consolidated, as I told you. So this consolidation can start from the center point or from the periphery. So if it starts from the center point, we will call it halo sign. Or if it starts from periphery, we will call it reverse hollow sign or Atall sign. Let me demonstrate it with this. You can see here completely. Let me enlarge. If you look carefully, then consolidation or solidification has started occurring at the center part. And around this is GGOs. Previously, there were the GGOs, but this solidification started at the center point. So we call it as halo sign. Okay. So there is one video also. This is the GGO. Okay. So I have taken some more CT scan picture. I will take a consolidated area and paste it over here. Very simple thing. Just to give you demonstration of photographic memory. I have clone from here and just pasting over here. Look carefully. If you look, so it will look like this. Okay, so very simple. This is our mode of teaching how to clear the thing. And if the consolidation, if the this solidification occur at the periphery, we call it a reverse hollow sign or Atall sign, like this. Look, so it is this term Atall sign is taken from Atall is a ring shaped coral reef island. Okay, land like a swimming pool. आसपास land beach में uh, uh, water है, and this is called as Atall sign. So here, if you see carefully here, let me zoom it out for you. If you see carefully here, you will see that consolidation, no solidification, brighter हो रहा है ना side में. So from the periphery, so we call it as the reverse hollow sign or Atall sign. Nowadays in COVID also, it's very important sign. So I have demonstrated. So a lot of patterns are there. Right now we can just go to the important part, and this was all about. And I would invite you to join my online CT learning program, where we'll be learning together in a two-way interactive manner like this, and on Zoom session, practice session, 30 to 40 days, and in the last you will become expert in CT, CT chest, CT medicinal anatomy, lung pathology, COVID radiology. Only we covered this part, COVID radiology, and CT scoring, CT CVT scoring of COVID case, and of course CT head emergency part like head injuries and stroke and some other pathology. So this will be a great journey for you to there good chance to increase your clinical skill. So please join, and WhatsApp me or call me at this number 99151 62832, or WhatsApp me, and or visit to my website and see. Let me type down here if possible, not possible here. So you can remember Amit Arora MCC from Medical Case Consultation in my group, amitarora.mcc.com. Just you will find this after this video below this, or inside WhatsApp group. Okay, so that was enough for today. Thanks, and thanks for joining, and hope to see you in our upcoming radiology learning program. Okay, thanks.